Tout le monde. Hello, everyone. Welcome to today's online event featuring very knowledgeable speakers who will speak about Internationally Trained Physicians of Ontario, an organization that helps internationally trained physicians across Canada. Before we begin our webinar today, we would like to begin with an acknowledgement that N4 is hosted at CHIO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. My name is Mariah, and I am a project coordinator with N4. I will be moderating and hosting today's webinar. My co-host is Andrew Tomeyer, who will be monitoring the question and answer box today. And I am now very pleased to introduce you to today's presenters. And presenters, I'm just going to ask that you turn on your video as I introduce you. And one of our speakers today, our first one, is Dr. Ahmad Alkhatib, Vice Chair of the Board and co-founder of the Internationally Trained Physicians of Ontario. Dr. Ahmad Alkhatib is an internationally trained physician that graduated from Sharia University in 2013. He is a general practitioner who worked in the hospital in the emergency department, in the corporate medicine department, and in the sports medicine department. His administrative positions include head of patient management committee and the head of the emergency development committee. He currently goes to and from the United Arab Emirates to work and continues to pursue licensure in Canada. He has successfully received certification from the Canadian Board of Aesthetic Medicine. Welcome, Dr. Alkhatib. Thank you so much for joining us today. And also who will be joining us for today's webinar is Dr. Makini McGuire-Brown, Chair of the Board of the Internationally Trained Physicians of Ontario, also known as ITPO. Dr. Makini McGuire-Brown is an internationally trained physician from Trinidad and Tobago with over 4 years of experience in general practice and anesthesia. She is the current chair of ITPO, holds a Master of Business Administration from the Schulich School of Business, York University, and is currently a PhD candidate at the same institution doing research on the psychological effect of accounting in health. Today's session is being recorded and will be uploaded to our N4 platform. We will share this with you as soon as it becomes available. Should there be any technical issues during this webinar, we will inform you with details for an alternate makeup session. And before we get into today's event, I would like to take a moment to introduce you to our platform features to help to enhance your participation experience. Throughout today's session, we invite you to write your questions in the question and answer window. And we know that sometimes many of you might have the same question or be interested in a particular response. So today you have the option of upvoting a question. Please upvote questions you are interested in hearing the answer to, and we will prioritize which questions we pose to the speakers first. And our speakers today have no conflicts of interest to declare. And with that said, let's jump right into today's presentation. I will pass it over to you, Dr. Alkhatib.
So hello, everyone. I'm Dr. Alkhatib, and I'm really happy to be a part of this meeting and share my experience as a physician in Canada, share my experience with you, the journey that we have, all the difficulties that we do. Now, to start with, I have a short presentation. I hope it won't be boring. I'm going to start sharing the screen with you guys. And again, if you have any questions, we can answer all your questions at the end of the presentation. We're going to use a lot of acronyms. I'm going to try to explain them as we go through. But the main thing that I want you to understand is everybody is well known with the term IMG, International Medical Graduate, which is not the right description for what we are. We're actually internationally trained physicians. So the term ITPO comes from Internationally Trained Physicians of Ontario. I'm going to go ahead and share my screen. Please confirm for me once you see the screen and the presentation. And I would love to check also if you can hear me clearly, you can see me clearly. Is that good with you guys?
Good, Dr. Alkhatib.
That's good. That's great. Okay. Started at the closing remarks. Okay. So internationally trained physicians of Ontario, helping internationally trained physicians across Canada. Dr. Makini, hopefully she is trying to join us. She has some kind of class she's teaching. Hopefully she'll finish and she will join us. She is the ITPO chair. Myself, I'm Ahmad Alkhatib. I'm the ITPO vice chair and the co-founder of ITPO. As an introduction, I want you to understand what we're presenting today. What are the main things that we're presenting? The agenda of today is, who is ITPO? What do we do? And why is it important? These are the main things that I'm going to cover in this presentation. Now, who is ITPO? So ITPO, you see under it right now, Stronger Together, Fortissimo Owner. This is very important because this is not just a slogan. This is our actual story. And I'm going to touch upon that once we come to the background story. So who's ITPO? It's a federally incorporated non-for-profit organization, founded and run by ITPs. Again, ITPs are the internationally trained physicians, serving ITPs across Canada. We have over 1,600 members approximately from all across Canada. These are all physicians. These are all physicians who are trying to recertify themselves in Canada. Few lucky ones got into the system, become incorporated in the Canadian healthcare system. We are small, but growing really fast. We have licensed and unlicensed doctors. We have approximately 50 people who got licensed and currently in the Canadian healthcare system. And they are helping others to carry on the same pathway. We have 7 board members. I'm going to introduce the board members to you right now. So we have Dr. Makini McGuire. And again, I always say she has the best smile between all of us. You can all see her smile. She's a very nice and very capable lady. And that's why she's our chair. That's me, Dr. Alkhatib, the vice chair and a co-founder. Dr. Joanna, one of the nicest members that we have. She has great soft skills and she's the one who organizes all. We have Dr. Ramil Ani, which is one of my best friends. We went to universities together and he is also a resident right now in pediatric department. And also he is the co-lead for practicing ITPR. What that means that we extend our support even for doctors who are already in the system, who are already residents, because they still face some difficulties as non-Canadian graduates. We have Dr. Mariana Jordan, she's the Director of Communications. We have doctors, and these are the newer board members. We have Dr. Sarah Zia, Director of Resources, and Dr. Andre Coleman, which is also a resident, and he's also a co-lead with the practicing ITP arm. So he's also working with Rami in supporting physicians who are inside the Canadian healthcare system. Now the background story. You heard about the definition of ITPO, but these are just words on a presentation. The real story started. Basically, you have to understand, and I'm just going to give you a snapshot of reality. What happens to an internationally trained doctor when he comes to Canada? The first thing that he has to take care of is him being an immigrant. That means he has to be a legal immigrant. That means he has to have a status in the country. In order to have that, he needs to have the permanent residency card, which is very important. Having this permanent residency card plays a big role in our journey because you are required to stay in Canada for more than 3 years to acquire your Canadian citizenship. So that's very important for any immigrant who's trying to start a new life in Canada. Why that is important, it's going to come in the story later on. So I'm going to use myself as an example. I came to Canada. I was highly qualified. I have more than 4 or 5 years of experience in emergency. The first thing that will happen is you will verify your papers, you try to do your exams, and you start your journey. During that time, while I'm fighting this uphill battle, trying to recertify myself, COVID hit. And when COVID hit, believe me when I say every internationally trained physician felt a big responsibility on their shoulders to help and to be part of the solution. not considering ourselves as a part of a problem. No, we were trying to become part of the solution. So me and other doctors, we started contacting each and every hospital around us. We started contacting all the long-term care centers that are around us, asking them, telling them, listen, we are qualified physicians. You are calling for retired nurses, you're calling for retired doctors to go back to duty. We are here, we are ready to help. Utilize us. And they did not know what to do with us. The best thing we would say, we would get as a response is that, you know what, come become a volunteer. That means you will not have any medical capacity. You will not be able to diagnose, you will not be able to help, you won't be able to do anything. The maximum you can do is direct patient, go left, go right. This is the clinical examination room or such kind of very minor involvement. So that's when we started talking to each other, because when you're doing your exams, you have a community and you share the same problems, you share the same concerns. So we started contacting the CPSO, which is the College of Physicians and Surgeons, the Ministry of Health, but contacting individually doesn't lead to anything because you don't have that much of a pull. So me sending an email to the CPSO won't get me anywhere. They will reply in 2 to 3 weeks, and it's going to be very kind of generic reply that won't lead to anywhere. And we realized the main issue is that internationally trained physicians have zero representation in Canada. Everyone else has representation except for internationally trained physicians. So that's when we decided to organize ourselves. And it was a funny story because keep in mind that we are all immigrant doctors. We have no knowledge of the system. We don't understand how to walk our way through it. We don't know how to start a non-for-profit organization. So we had to Google it. We had to learn the legal aspect of it. We had to pay for the legal fees and do all these things and kind of pull ourselves by the bootstraps to be able to do this organization. And I was lucky enough to have these board of directors that are, each one of them has their own qualities and highly motivated doctors that we were able to manage to do this and put this organization together and grow it. So we are honestly very proud of what we were able to achieve with the minimum resources that we have. And funny fact that I remember the first time when we were doing the paperwork, we wanted to have a location to register it. And none of us had any location. We didn't rent anything. So we had to register it on a rented, which is what that was the house that I rented in the basement. That's where the location of ITPO when it first started. Thankfully, when we grew bigger, we managed to change that location. But that is the background story. And that's how we started.
Ahmad, so sorry to interject. There's just a couple of participants that are having an issue hearing your voice. I'm wearing a headset, so it's clear for me, but is there any way that you might just be able to move closer to your microphone?
So I'm wearing headset as well. So there's no way to move unless if you want me to take it off and try to
no, basically. I think we'll just leave it as is and we'll enable the transcription.
Yeah, sure. I'm okay. I can speak louder if they want.
That's a little bit better. Okay. Thank you.
Yeah. Okay. So why couldn't ITPs help during the COVID pandemic? That's a story by its own. Because as I told you, most of the ITPs that I know, the international trained physicians, tried their best to find a way to help. And even they did a short-term license, short-term supervised license. We all applied for it. None of us got it. We don't know why. What's the reason? We tried our best. We offered ourselves as a solution, and it was underutilized, and we couldn't. Me, myself, I live in a military town. It's called Perawawa. It's in the Ottawa Valley. It's around an hour, 45 minutes from Ottawa. And during that time, I did my best. I even contacted the military, told them, listen, I'm an emergency doctor, I'm trained, I can help. We don't need anything in return. Just let us do our job. And it led to nowhere. The best thing I could got was to disguise as a PSW, as a personal support worker. and to go, that's the only way they can get me into the long-term care settings, to go there so that the nurses will feel comfortable when they have COVID cases, that there's a doctor in case there is any emergency. So I was disguised as a PSW and working around giving medical/non-medical advices, because I cannot do more than that. I can only give an opinion. I cannot prescribe. I cannot diagnose. It's not in the scope of my practice over there, because I'm considered as a PSW. So they just ask for my opinion, and that's what I managed to do during COVID. And hopefully we were able to help according to the best possibility that we can. Now, that was the pandemic story. And from that was the birth of ITPO, when we saw that all these internationally trained physicians were not utilized, and they can help and they can offer all these services to the Canadian healthcare system. That's when we decided to start this organization, and we launched it during the pandemic. And so what does ITPO do? ITPO has two main branches, the advocacy branch and the resources branch. For the advocacy branch, we advocate for better routes to licensures for internationally trained physicians. We highlight the barriers currently faced by the internationally trained physicians. As for the resources, and that's when we grew bigger, that's when we had the resources part. We provide free resources to assist ITPs along the way to licensures. And the way we do that is because of the organization of how we organize ITPO. So people who pass a certain exam, once they get a high mark, they join ITP. They already joined it before, but they become kind of member of the faculty, and they start teaching the people who are studying for the exam. This is all done for free, funded by ITPs to ITPs. And again, when we grew bigger, when the courses became better and people started joining, now other organizations who are working with the internationally trained physicians or the IMGs started contacting us. And once we make sure that our goals align, we make some, and we have to make sure that they don't have any monetary gains from that. We started align ourselves with them and ask them for free courses, free resources. When, for example, we aligned ourselves with some kind of organization that are teaching people how to write their CVs, how to apply for researches, any job opportunities for international trained physicians. And that's what happened. The advocacy work was a big part of our mission, basically. And in the advocacy part, we had the MPP chat, which is all the member of parliaments, the member of provincial parliaments in Ontario, most of them, not all of them. We tried to contact them, we sat with them, we had meetings with them, and we had the constituents with them to sit with them and explain all the barriers of entry. And we managed to work with the NDP as well for them to pass a bill on our behalf to have a chair at the table of the stakeholders. And it's working, hopefully. It's going to progress and it's going to be better. We did the MLA chats as well. We did the Equal Chance campaign, which was a social media campaign explaining about the issues of ITPs. And we launched several advocacy campaigns, and that were kind of successful. Now, the barriers. So the barriers to entry are a lot, and the way to summarize them is saying that there are dysfunctional route of licensure. Basically, there are two main routes. When you're coming to Canada to become a physician, a practicing physician in Canada, you have two main routes. One is called residency spots, which is when you apply through CARMS, the Canadian Matching Residency System over there, or CARMS is Canadian Residency Matching System. When you apply through that, you go through residency. And there is the practice ready assessment. And both of all these systems that are in front of us are kind of rigged against internationally trained doctors. And I'll give example for each and every. So too few residency spots. For example, the need in Canada is for family physician. It's the maximum need that they require over here. There are more than 680 doctors applying. That's according to the statistic of last year, for example, more than 680 doctors who are applying as internationally trained physicians to the residency spots. And there were only 30 residency spots that are offered in Ontario. So that's less than 5% of people who are getting accepted. Now, too few PRA spots. What is the PRA spot? PRA spot it's called practice ready assessment, and it's only offered in few provinces. So that's the first problem. Ontario doesn't have a PRA, doesn't have practice ready assessment. This is basically a program that will allow you to work right away as a practice ready. So you don't have to go to residency and repeat your own training. You're trained, you have more than 3 years of experience, you're able to practice right away. The issue with that, the main issue with that is the recency of practice. And I'll give you an example. So when you come into Canada, you're doing the exams. First of all, you have to verify your papers, your medical certification, and all these things. You verify it through the physician apply, and this could take 2 to 6 months. After you get acceptance, you will be able to do the exam. You prepare for the exam between 4 to 6 months. You do the exam, you pass it. 45 days later, you get your degree. Then you have to do another exam. If the first one was QE1, then you have to do the NAC OSCE exam, which again, you will require 4 to 6 months of preparation. Let's say you study really fast and you're very well prepared, you'll finish it in 3 or 4 months. Again, it will take you around a month to get your results. So by the time you finish the exam and you're eligible to apply for the route, you're already more than a year into coming into Canada, and you already haven't practiced as a doctor for a year. You apply for the practice ready assessment. Again, they're going to take your paper, they're going to evaluate you, they're going to evaluate your core rotations, your internship and everything. Again, it's going to take 4 to 6 months. By the time they want to give the reply, if you did everything very fast and you passed all your exams, you're going to be a year and a half in. And in some provinces, they won't accept. They say you have a gap of a year and a half or 2 years or whatsoever. So you don't have recency of practice. We're not going to accept you. So again, the system is kind of rigged against you. As for the Royal College of Physicians and Surgeons and the assessment, and this is another pathway for people, I don't want to go into details for this one, but I'll just give you a simple example for this one. They ask you for people who are coming as a specialist in different departments or coming from the Middle East or from Africa or Asia. When they come in, they have the practice eligibility route. When these people come in, they ask them for 2 years of experience, of working experience in Canada as an eligibility criteria. How can you have 2 years of experience in Canada if you're not allowed to work as a doctor? So again, there is some misunderstanding in the system. Now, this is regarding the barriers regarding the routes to licensure. As for the financial and physical instability, the first thing that you will face is there is no way to work or practice as a physician. And that could be a devastating thing for a doctor. You will have difficulties to support your family. So you will find a lot of physicians who are working in it, not in their field. So you'll have people who are working Ubers, people who are working Tim Hortons, construction, so many other different ways. You have the waning of the recency of practice, which is what I explained in details when it comes to the practice of the assessment. And again, this is one of the reasons that I'm talking to you right now, currently from United Arab Emirates, because I went back to keep the residency of practice. And that could be painful. Why? Because I have a family. My family lives in Canada. I have a 5-year-old. I have a wife. They're waiting for me over there. But I have to come here, spend 3 to 6 months to keep the license ready, and then I have to fly back to Canada. And this could be costly, whether it's financially or socially or psychologically taxing on me. Flying back and forth and maintaining the system. The solutions that we offered through our organization. The first solution, and the most important one, is to be at the table of the stakeholders, including us, so that we can explain these things to them, so that we can give them the realities that we're facing. We also suggested to have a PRA in all provinces, introducing it to Ontario. Not only that, we suggested that the criteria to review these pathways, so that they're not that strict and they're more accommodating to internationally trained physicians. I'll give you an example for the PRA again over here. They have specific criteria about the kind of your core rotation. So we do rotations in family medicine, in internal medicine, in pediatrics, in surgery, psychiatry, OB-GYN. So these are the core rotations. Each country divided according to their needs. So in my rotation, I did 3 months in surgery, 3 months in internal medicine, because these are the main big branches. Then 2 months or in pediatric, 2 months in OB-GYN. I did 1 month, for example, in psychiatry. When you come in and read the criteria of practice ready, they will have their own criteria that is very rigid. For their example, they will ask 2 months in psychiatry. If you don't have 2 months in psychiatry, then you're rejected. And that will exclude a big portion of the people who are applying. There's a better way when you revise these policies and you can tell them, you know what, if someone is missing a month in psychiatry, let's say, or a month in OB-GYN, you can offer him a supervised internship of a month, non-paid. They're going to be so happy to apply and do this happily. I don't think any internationally trained physician would refuse on the promise that he will get accepted in the practice for the assessment. One major solution that can solve so many problems, the financial problem, the flying back and forth, the recency of practice, is an official clinical assistant role. This is a physician assistant or a clinical assistant role that is very important. So again, when you come in here and you're trying to support your family, you're going to deviate from medicine because you cannot work as a doctor. So you're going to find other jobs, and these jobs might be detrimental to your clinical pathway because you're not studying, you're not attending the hospital, you're not seeing patients. And having this clinical assistant role will help you to be included in the Canadian healthcare system. And also it will enrich the Canadian healthcare system because you will be the right hand for the doctor. The doctor that is seeing 20 patients per day will be able to see 30 and 40 patients. If you have a clinical assistant that is examining the patient for him, writing his note, assessing the patient, having this discussion with the doctor. And again, the Canadian healthcare system will be enriched because they are gathering all the international experience that people are bringing from the Middle East, from Asia, from Africa. And these are people who have more than 5 and 10 years of experience in their designated fields. So it can definitely enrich the Canadian healthcare system. One more important point, it's not going to cost the government a lot, because when you are a clinical assistant, you're not going to be paid the same salary for a doctor. It's going to be something like a resident doctor or a nursing salary. A clinical assistant, I think, is one of the best opportunities because again, you are having a practical role. So the recency of practice will be really good. You won't need to fly back and forth. And it comes without saying, increasing residency spots over here, because again, it doesn't make sense that more than 600 people apply and only 5% of these people get accepted in the residency spots and getting training. So that is something we need to work out with the Ministry of Health, hopefully. Now, spreading the message, that's what we do with our media campaigns, with the advocacy. We have, as I told you, the Equal Chance campaign, the MPP chats, the Member of Parliaments, the Provincial Parliament chats, the Skills to Help, collaboration meetings, ITPAC West, what we're having right now with N4, CPSO, we sat with them, the Royal College of Surgeons, we sat with them, Ontario Hospital Association, the Ministry of Health, we sat with all these people. We tried to explain the issues and they promised to help, but we didn't see something solid so far. According to our media involvement, we had live broadcasts, articles, podcasts, radio, global news, CP24, Toronto Stars, York Region. We're always active in all media pathways and hopefully we'll still be more active. Now, this is some pictures about our advocacy. And this is the MPP, Dol Begum, who I sat personally with her more than once, and she helped in passing the bill with us. And this is Dr. Shruti. She's telling us her story, and she works with the Still to Help branch. We have the M4 team. I don't know why my photo is not here with the M4 team, although I think this meeting I wasn't there. And that's our chair, Makini. She had some interviews with the CP24, and she explained she can basically put everything together and explain the barriers to entry in a very nice way. So she did it on CP24. Our resources, and this is a new it's not a new, but we only had the resources committee when we grew bigger. So the resources committee, it offers something very special, and especially that it's really free. Nobody's paying anything, and even the people who are giving these lectures are not getting paid. So we have Cracking the CARMS. Again, CARMS is the Canadian Residency Matching System. So we give some presentations of how to write your CV, how to sit on the interview table, what to say, what not to say, how to enrich your experience before getting into the interviews. Between the CARMS, these are basically it's training for the exams, the QE1, the NAT, what to do, what not to do when you're waiting for the other cycle of CARMS. And before the CARMS, again, this is the NAT, OSCE, the QE1, the prep sessions, and all of them. So we have all these courses, and we're offering them for free. And one thing that is not mentioned over here in the resources, I think the main important resource that we offer is a community. So there is a community between internationally trained physicians that they can communicate, they can reach each other, they can help each other, they can share resources between each other. And that was something that I lacked when I was trying to apply for my exam. I wish that I had that amount of community that I can reach out to and share my questions with them. So that's something that we offer as well through our Slack channels. Now, ITPO, again, the way it's organized is run by volunteers. Nobody's getting paid, nothing, nobody is being charged anything. So we have three committees. We have the policy and advocacy and research committee. We have the professional resources committee. These are where all the courses are coming. Policy advocacy committee is where all the advocacy work is happening. And if we have any research, it will happen over there. We have any, we want to work on policy, work with the politicians. Well, it's all this committee. They do a lot of work over here. And then the recruitment and engagement committee is how to recruit more members, how to reach out more, how to reach out to more ITPOs. So again, if anyone wants to volunteer, we'll be more than happy to just click over here. We'll be more than happy to get you on board. And so why is it important? Why is what we do important? So I think the health system is in crisis right now. According to ITPO survey report, the healthcare system is in crisis right now. And ITPOs are diverse, underutilized, skilled health and human resources. This is why ITPs have to offer. This is what we have to offer. And again, I think one of the main important things that we offer is there's no other organization right now that are offering the same scope of services that we're offering on the advocacy part and on the free services part. And that's why I think ITPO is very important. These are some surveys that we did and some data analysis that we did. So what you have to understand is that internationally trained physicians, they have no roots to a specific area in Canada. So they are more than happy and willing to relocate wherever there's a job opportunity. So that's why ITPs can be utilized in the rural area, in the communities that do not have enough doctors, no healthcare system, or the healthcare system of there is not as strong as it is in the main cities. So when we did a survey with all 1,600 members that we have, 87% of them said, yes, they're willing to relocate. Well, if you do the same survey with I believe with a Canadian medical graduate, you won't have an 87% acceptance for that specific question. And now this is regarding the experience with the marginalized communities. You will see immigrant doctors or internationally trained doctors have a good experience, more than 67% of experience with tuberculosis, more than 85% of experience with diabetes mellitus, HIV 36%, mental health around 46%. The geriatric community, we have 61% with them. With the indigenous community, and that is a very accurate thing, because again, mostly they are immigrant doctors who came to Canada, so they don't have that much experience with the indigenous community. But if you mix that with this life, are they willing to relocate? Are they willing to go and work in the indigenous community area? 100% they're willing, and they'll be happy if there's an opportunity offered for them over there. With the inner cities, yes, they have 37% of experience over there. Now, this is again to show why we don't call ourselves IMGs, International Medical Graduates, because we are not international medical graduates. We are doctors with more than 4 and 5 years of experience. So you will see in our calculation, we have only 8.9 or 9% less than 1 year of experience after graduation. We have around 28% of us 1 to 3 years of experience. We have 22% 4 to 6 years of experience. We have, again, around 20%, 7 to 10 years of experience, and around 20% more than 10 years of experience. So these are not international medical graduates. These are doctors with a valid experience, with a vast experience, actually. And over here, this is just to describe the areas of clinical expertise. So here it's called general practice. General practice, what basically means is a family physician. That's general practice. So 56% of internationally trained doctors are general practitioners or family medicine doctors. And this is what Canada needs most, because that's how they deal with the rural area. They put a family doctor in Perawawad. We have only 4 family doctors over there. We don't have a pediatrician. We don't have any specialist doctor. The town is run by family medicine. So that's what they do. They need family doctors to spread them around the rural area. We have 56% of us that are general practitioners. And then you will see that kind of a very similar distribution, except for, I think, pediatric is more. Yes, pediatric is around 7%, obstetric gynecology 5%, and surgical specialty is around 6%. And you see it's very well distributed, the other 44%. Closing remarks, ITPO continues to work toward ensuring doctors can be doctors. It's open to all ITPs across Canada. So it is called Internationally Trained Physicians of Ontario, but it's actually, we have doctors all over Canada. So yeah, if you're not yet licensed, you can use this link. If you are on your pathway to get licensed, you can use this link. And I promise you that we're doing our best to keep up the good work, and hopefully we'll get somewhere. Thank you very much. Now I welcome any questions. I try to make it concise so that you guys don't get bored with the presentation. I know there are lots of information, so I'm more than happy to answer any questions.
Wonderful. Well, thank you so much, Dr. Alkhatib, for that really illuminating presentation. I learned so much, as I'm sure many of the participants did as well today. And we have several questions, and I just want to get right into them so we can give as much airtime to the question and answer period as we can. And the first question I'm going to start with is just on the point of membership. Can someone who is not an internationally trained physician or international medical graduate become a member? And also, are there other organizations like yours in Canada's other provinces outside of Ontario?
Okay, yeah. So these are actually 2 important questions. So there's a very good start for the Q&A section. So yes, we had lots of members who are not internationally trained physicians. The way they become members is if they can volunteer or if they can add services to ITPs, then we definitely welcome them. We had lots of people who were touched by our stories, who were techie people, and they said, you know what, our brother has been through this, and right now he's a fully qualified doctor and blah, 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 and he's successful, he's working, he's busy, but we share this experience with you and we want to help. So these are people who helped us, for example, in in running our social media campaigns and running our websites. There are so many people who had other kind of skills. So we've been contacted by a lady, her name is Maria with Think Outside the Box. She does some kind of blogging, and she was again touched by the stories of ITPs, and because I think one of her family members was treated by an internationally trained physician, and she said, you know what, I want to pay back. So what can I help? So we asked her, what are your skills? She said, I'm really good in writing. I can teach people how to present themselves in the English language. I can improve it for them. I know there are some people who are coming from different backgrounds, so I can help in that regard. So she started actually giving free courses in ITP regarding when you want to write your CV or when you want to present yourself. So that definitely there are so many pathways to enter the internationally trained physicians. It's going to be as a volunteering thing, and we'll be more than happy and welcoming to affiliate with anyone as long as they share the same goals, you know.
Great.
Regarding the second part of the question, I believe there was a second part of the question, which is, are there any other organizations that are like us in other provinces? So we work with other provinces. We work with BC, we work with any, because we cover, when we tackle the Canadian healthcare system, we tackle it as one block. We don't tackle it as the issues in Ontario versus the issues in Alberta versus in, you know, we tackle it as one block. So any doctor who's in Canada and he wants to gain his residency spot, or he wants to recertify as a physician, we will work with them. So if anyone who's from outside Ontario, definitely for sure they can join. And we have actually 2 or 3 from the board members who are outside Ontario or in BC and one in Alberta. So yeah, definitely that is there. And yes, there are so many organizations right now, but each one is working on a different pathway. ITPAC, for example, is a collision of more than 4 or 5 of internationally, or they work with IMGs and internationally trained physicians just for advocacy. So these people will not want to, they do not want to, for example, have anything to do with the physician themselves, because they're not going to work with the physician. They're going to work with lawyers. They're going to work with stakeholders. They're going to do some work with the government. West, I think, do also a lot of good work with internationally trained physician, which is, you know what West stands for, right?
World Education Services.
Yes, the World Educational Services. So West, I think they work with internationally trained physicians as well. Several other organizations. There is Health Force Ontario. It's another organization that works with international, and that's government supported or government funded. Also, they offer resources, and we also try to work with them. When we share resources with them, we take statistics from them. There's some kind of communication between us and them. But again, the way we situated ourselves is that we're gonna work, we're gonna do our advocacy job, and again, we're gonna give free resources. I haven't seen so far an organization that has these 2 core values in it, and they're offering it in the manner that we are offering.
Thank you so much, Dr. Alkhatib, for clarifying and answering those questions. And our next question, the participant is asking, so for the regulatory bodies, the colleges in each province, one of the biggest considerations they have is around and grounded in public safety and quality of care. So do you think that the medical programs that are offered internationally could implement some changes so that their education is comparable to Canadian education? Can you tell us your thoughts on that? Yeah.
And again, that is, who asked this question? Because that is a very thoughtful question. Who did it come from?
I believe this is coming from an internationally trained physician.
International.
This question.
Okay. So it's a very thoughtful question. And I think that in order to answer this question correctly, so I was trained in United Arab Emirates. United Arab Emirates and Dubai, for example, has the highest quality of medical care. Like there's nothing over here where you have to wait in the emergency room for 8 hours or 6 hours. I have to see my patient in 10 minutes. If I don't see my patient in 10 minutes, if there's no doctor visit in 10 minutes, the patient has a right to complain against me. I'll give you a personal example. You can have an access to any specialist at any time. So if you want to see a dermatologist, if you want to see a plastic surgeon, not even a medical emergency, over here, you have the access to that. So if you want to say whether my training was comparable, it was definitely comparable, but I cannot gauge it only to what I studied over here. But I can give a solution. The best solution is to bridge. It's not to disconnect. So that's why we said bridging through the clinical assistant program, coupling the internationally trained doctor with the Canadian doctor will build these bridges and will approximate if there's any lack of knowledge, will approximate all these things so that when the international trained doctor comes in and he does like 6 months or 1 year with the Canadian doctor, he will learn all the things that he is required to learn. So after he wants to practice in Canada, he wouldn't be only passing an MCQ exam. He would have a clear knowledge of the Canadian healthcare system. This will reduce the mistakes. This will make over better doctors. The coupling system between the international doctor and the Canadian doctor definitely has its own advantages. And I can tell you the main difference between an international trained doctor and a Canadian doctor, it is not the medical knowledge, it's the cultural background. So it's the ethical background. So there are some things, for example, are accepted in Canada, I cannot apply them in United Arab Emirates. For example, I cannot give contraceptive pill for a minor in United Arab Emirates. So if I come here with that mentality and a 14 years old comes to me in private and tells me, you know what, I had this and I need a contraceptive pill. In Canada, you have to be offering her the contraceptive pill right away. In United Arab Emirates, you're not allowed and you can report this girl. So there are different in the ethical, in the medical legal issues, but it's not in the medical knowledge. That's what I figured. That's what I noticed studying the Canadian exams and going through that.
Thank you. Thank you very much for articulating those cultural differences and providing those examples. That was very helpful. What are some of ITPO's proposed solutions? And I think you touched on this. The question was asked, and then I saw you had a slide in your presentation with those proposed solutions, and I really appreciated that. And you also mentioned in the proposed solutions that different stakeholders need to be brought to the table. Can you just expand on who those stakeholders are, who they would be to bring to the table?
Yeah, for sure. So the Royal College of Physicians and Surgeons, the OMA, Ontario Medical Association, the CPSO, the College of Physicians and Surgeons, CPSO, the College of, College of Physicians, not the Royal College, College of Physicians and Surgeons in Ontario, CPSO. I'm really bad with acronyms. I hate them. That's why I say
there's a lot.
Royal College of Physicians. So so CPSO and the Royal College of Physicians and Surgeons and the Ministry of Health. These are the main stakeholders. And actually our proposition is not to bring them to the stakeholder table, to bring us to their table. We wanted to sit with them, to explain to them what we are going through, because they're totally disconnected from us. They don't know what we go through. When we sat with them, they were overwhelmed. But again, the problem is really multifaceted. So when you talk to the CPSO, they will tell you that, oh, you need to talk to the MOH. When you talk to the MOH, they tell you, oh, but that's not us. You need to talk to the Royal College of Surgeons. When you talk to them, so we need to get them all together in one meeting and tell them, you know what, we're facing these problems. We are a solution for your problems, and we can help utilize us in that way.
Right. Yes, the power of that cross or multi-sectoral collaboration is really key here. And also it sounds like involving the voice of those who are going through the system. You know what the system best because you're going through it, and you should be involved in the solutions. So I'm just going to move to the next question. And there's this next question is the system lacking a clear path for mid-career doctors coming to Canada? And it was interesting when you shared your data, because it looks like there's a lot of internationally trained physicians that have quite a few years of experience, international experience. And I appreciated that you clarified kind of the difference between an IMG versus an ITP for that reason. So are there any mid-career pathways, Ahmad, that you're aware of?
Yeah, so if the person who asked is saying that a mid-career pathway, by that they mean a specialist doctor, let's say a specialist pediatrician or a specialist cardiologist, then yes, there is a lack in that. Why? Because there's no clear pathway for highly specialized doctors to come in Canada. And the reason why they're not bothered by that, because there's not that, well, I think there is that much need, but the way they think of it is that they need family physician doctors, because the family physician can deal with the problem. If the problem is complicated, then they send it to the highly specialized doctor. So there are more pathways for family physicians, for general practitioners. There are less pathways for specialized doctors. So if you have a specialized pediatrician, when he comes here, there are less pathways. There are the Royal College of Physicians and Surgeons offer basically two pathways. One of them is a solid pathway, and it's good, but that only includes approved jurisdictions. Approved jurisdictions are the, if I remember them correctly, they're in New Zealand, Australia, South Africa, and UK and US. So these are the approved jurisdictions. And funny thing, most of the doctors who are from these countries, they don't not want to leave their countries, because these are very good countries that you don't want to leave and immigrate. Some of the UK doctors come over here. US doctors rarely come over here. Australian doctors rarely come over here, you know? So you don't have a lot of these doctors. Most of the doctors, if you look at the data, they're coming from Asia, the Middle East, Africa. They're coming from the Arab countries, Gulf countries. They're coming from a lot of them from India and Afghanistan. A lot of them from, you know, these are the countries that you will see the immigrants are coming to Canada from. And these ones, they have what they call practice eligibility route, which is lacking. It is really lacking. There's a big hole in that system, because they ask you for 2 years of experience inside Canada, where they don't allow you to practice in Canada. So I don't know how they designed this kind of pathway, because I wanted to apply for that pathway. Then they asked me, do you have 2 years in Canada experience? I said, no, I don't, but I have training. But then you don't get accepted. Allow me to work to get the 2 years of experience. I don't mind. No, we can't allow you. That's a provincial issue. We are the Royal College. Again, we go in a circle where there's no answer. So it's complicated.
Lots of complexities for sure. Yeah, thank you.
That's why there's ITPO. That's why there's ITPO.
Right. So there's widespread acknowledgement across Canada that there's a health human resource crisis. Could the public have a role in advocating for the need to remove some of the barriers or improve the process of licensure for internationally trained physicians?
Definitely, and I think this is one of the goals of this meeting, is to get the public attention to what we're going through, so that we can have support. And that's why I said stronger together, or Fortissimo Una, because we want you to be together with us in fighting this battle. Because again, we present ourselves as a solution for this human resource crisis in the healthcare system. We are, let me give you the statistics. Just in Ontario, there's more than 7,600 internationally trained physicians who are not working as physicians. 7,600. If you utilize these doctors, you wouldn't need any retired doctors to go back home. There won't be any problem with in Renfrew County right now, where I live, there's more than 27,000 families that do not have family doctor. You won't have these kind of issues over there.
Thank you. Thank you, Dr. Alkhatib. And we have time for about one more question for the live Q&A. And it's just around ITPO, your success rate for residency match, which I'm not sure if that's a service necessarily that ITPO provides, but beyond that, is there any data that you're aware of or data that you collect related to statistics like success rate or residency match?
I honestly don't have, but I was so happy when it was pronounced because I saw lots of the board member who applied got accepted. Like we have 4 out of 7 got accepted over there. I didn't apply this year because I was in between Canada and United Arab Emirates. But I don't have the exact statistics. But let me tell you, they're disappointing because the spot number is disappointing. Around, if you look at the health Ontario Health Force, you will see around 13% to 17%, depending on the of IMGs that get accepted into residency spots. So we do have a little bit higher of acceptance rate, but it's still disappointing. It's still not above the or not what we want it to be.
There's some sometimes a lack of data that's accessible to better understand the issue and to answer the particular question that the participant had. Unfortunately, we're coming to the end of time, Dr. Alkhatib, and I mean, we could continue this conversation, and just to let the participants know, we will be following the webinar, we will be doing a short recorded presentation where we will ask Dr. Alkhatib the rest of your questions. So we encourage you to sign up to N4, and you'll be able to access the recording of the rest of the questions that we have here today on our platform. I do want to make everyone aware of some upcoming webinars that we have related to the topics of internationally educated health professionals. So these are free to attend and open to professionals right across Canada. You can register for these webinars by signing the QR code or going to the N4 www.newcomernavigation.ca to sign up. We've also curated several resources related to today's webinar topic. You can find these in our resource toolkit, and we will link them when we share the on-demand version of this discussion. So if you haven't yet, please do sign up to our platform. And following today's session, you will be invited to complete a survey to share your feedback with N4. These help us to continuously improve and seek out new webinar content. So we kindly ask that you complete the survey. And I'd just like to give Dr. Alkhatib the final word. So Dr. Alkhatib, if there's one kind of key message you could leave with the audience, what would that be?
Sorry, I couldn't hear the last part. What was
if you have one final message that you'd like to leave with everyone today, what would that be?
Yeah, I would just want to say, I would want to thank everyone for attending and appreciate their time to listen to our issues. And I highly encourage you to, work in your own domain to help resolve this issue. And I think the needle has been pushed forward. So hopefully let's use this momentum and keep pushing forward to solve this issue. Thank you very much, everyone.
Thank you.